Hello everyone, and a special welcome to all the incredible women joining me today, who are navigating the vibrant chapter of life beyond 60. This is a time for wisdom, for joy, and importantly, for paying close attention to the messages your body is sending you. As we gracefully age, our bodies undergo changes, and while many are perfectly normal, some subtle shifts can be early whispers of something more significant that needs our attention. It's my mission to empower you with knowledge, because understanding these signals is the first step towards proactive health. Today, we're going to talk about 3 specific symptoms that I believe are particularly crucial for women over 60 to recognize. These aren't things to be dismissed as just part of getting older. They are important clues, and your body is a remarkable communicator. Ignoring these signs can sometimes mean missing an opportunity for early intervention, which, as you know, can make all the difference in the world. So, let's lean in, listen carefully, and learn together how to be our own best health advocates. Remember, knowledge is power, especially when it comes to your well-being. The information we'll discuss today isn't meant to cause alarm, but to arm you with awareness. These symptoms, unexplained weight loss, persistent fatigue, and shortness of breath, could indeed signal something serious. By recognizing them and understanding their potential implications, you're taking a powerful step towards safeguarding your health and ensuring you continue to live your life to the fullest with vitality and strength. Let's start with a symptom that often gets overlooked, or sometimes even mistakenly welcomed: unexplained weight loss. Now, I know what some of you might be thinking. Losing a few pounds without trying sounds like a dream. But when we're talking about a noticeable drop in weight, say 5% of your body weight or more within a 6 to 12 month period, and you haven't changed your diet or exercise routine, your body is sending a very clear signal. This isn't the kind of weight loss that comes from a new healthy habit. This is different, and it warrants a closer look, a conversation with your trusted physician. Why is this so important? Well, your body is an incredibly efficient machine. It doesn't just shed pounds without a reason. Unexplained weight loss can be one of the earliest signs of several underlying health conditions. It could be related to an overactive thyroid, which revs up your metabolism to an unhealthy degree. It might also be linked to issues with your digestive system, where your body isn't absorbing nutrients properly, perhaps due to conditions like celiac disease or inflammatory bowel disease, even if you haven't had obvious stomach issues before. We need to investigate why your body is using up more energy or not getting the fuel it needs. Furthermore, and this is a crucial point I want to emphasize, significant unexplained weight loss can sometimes be an early indicator of certain types of cancer. Now, I don't say this to scare you, but to empower you with the knowledge that this symptom should never be ignored. Cancer cells can consume a lot of energy, leading to weight loss even when you're eating normally. It's also associated with diabetes, particularly new-onset diabetes in older adults, which can initially cause weight loss before other symptoms become apparent. Your doctor can run simple tests to start to understand the why. Think of it this way: your weight is a barometer of your overall health. When it changes significantly without a clear reason, it's like a warning light on your car's dashboard. You wouldn't ignore that, would you? You'd take it to a mechanic. Similarly, your body is telling you something needs to be checked out by a professional, your doctor. They can perform a thorough evaluation, review your medical history, and order necessary tests to uncover the cause. It might be something easily manageable, but finding out is key. So, if you or a loved one has noticed the numbers on the scale going down without any intentional effort, or if clothes are suddenly much looser, please don't just brush it aside. Make an appointment with your doctor. Explain what you've observed. It's about being proactive, about listening to that inner voice, that physical signal that says, something's different here. Early investigation can lead to early answers, and that's always the best path forward for your health and peace of mind. Next, let's talk about a symptom that is so common, it's often dismissed as an inevitable part of aging or a busy life: persistent fatigue. I'm not talking about the tiredness you feel after a long day or a poor night's sleep. I'm referring to an overwhelming, bone-deep exhaustion that doesn't improve with rest, a fatigue that interferes with your daily activities and quality of life. If you're constantly feeling drained, lacking energy for things you used to enjoy, and this has been going on for weeks or even months, your body is trying to tell you something important. This isn't just being tired. it's a significant signal. This kind of profound and persistent fatigue can be a symptom of a wide range of underlying health issues, many of which are more common as we age. For instance, it can be a sign of anemia, where your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues. This will, quite literally, leave you feeling weak and exhausted. It could also point to an underactive thyroid or hypothyroidism, where your metabolism slows down, leading to a pervasive lack of energy. These are conditions that, once diagnosed, are often very treatable. Beyond hormonal and blood-related issues, persistent fatigue can also be a red flag for heart conditions. When your heart isn't pumping efficiently, your body's organs and tissues may not receive enough oxygen-rich blood, leading to that overwhelming sense of tiredness. This is particularly important for women, as heart disease symptoms can be more subtle than in men, and fatigue is a common one. Additionally, conditions like sleep apnea, where your breathing repeatedly stops and starts during sleep, can lead to severe daytime fatigue, even if you think you're getting enough hours in bed. Your body isn't truly resting. Chronic infections or inflammatory conditions like rheumatoid arthritis can also manifest as persistent fatigue because your body is constantly fighting a battle internally, draining your energy reserves. Even mental health conditions, such as depression or anxiety, can present with profound physical fatigue. It's crucial to understand that this isn't all in your head. The mind and body are intrinsically linked, and emotional distress can have very real physical consequences, including sapping your energy. Ignoring this can delay getting the help you need for both your physical and emotional well-being. So, if you find yourself saying, "I'm just always tired," I urge you to see it as more than just a passing phase. Document how long you felt this way, how it impacts your daily life, and any other accompanying symptoms. Then, share this information with your doctor. They can help you explore the potential causes, whether it's a nutrient deficiency, a hormonal imbalance, a heart issue, or something else entirely. Don't accept debilitating fatigue as your new normal. There are often solutions, and it starts with seeking answers and not dismissing what your body is clearly communicating. Finally, let's address a symptom that can be quite alarming, and rightly so, shortness of breath, or as doctors call it, dyspnea. I'm talking about a noticeable difficulty in breathing, feeling like you can't get enough air, or experiencing breathlessness during activities that didn't previously cause you trouble. Perhaps you now get winded climbing a flight of stairs you used to take in stride, or you feel breathless even when you're resting. These are not sensations to be taken lightly, especially as we get older. Your ability to breathe easily is fundamental to your health. Shortness of breath can be a critical warning sign of underlying problems with your heart or your lungs, two of the most vital organ systems in your body. When it comes to your heart, difficulty breathing can indicate conditions like heart failure, where the heart muscle isn't pumping blood as effectively as it should. This can cause fluid to back up into the lungs, making it hard to breathe. It can also be a symptom of coronary artery disease, where the arteries supplying blood to your heart become narrowed or blocked, or even a heart rhythm problem, an arrhythmia. Prompt medical attention is absolutely vital in these situations. From a lung perspective, shortness of breath is a hallmark symptom of conditions such as chronic obstructive pulmonary disease, or COPD, which includes emphysema and chronic bronchitis. These conditions make it harder for air to flow in and out of your lungs. Asthma, even if it develops later in life, can also cause episodes of breathlessness. Other serious lung issues like pneumonia or even a pulmonary embolism, a blood clot in the lungs, can present with sudden or worsening shortness of breath and require immediate medical evaluation. We must listen when our breath falters. It's also important to note that sometimes, shortness of breath might not be constant, but may occur or worsen with certain activities, like lying flat, or it might be accompanied by other symptoms such as chest pain, wheezing, coughing, or swelling in your ankles and feet. These associated symptoms can provide your doctor with important clues about the underlying cause. Keeping a mental note or even a written log of when your breathlessness occurs and what makes it better or worse can be incredibly helpful when you discuss it with your healthcare provider. Therefore, if you experience any new or worsening shortness of breath, please do not delay in seeking medical advice. Don't try to tough it out or assume it's just a sign of aging. Your doctor will want to hear about this. They can perform a physical exam, listen to your heart and lungs, and may recommend further tests such as a chest X-ray, an electrocardiogram, or ECG, or lung function tests to determine the cause. Identifying the reason for your breathlessness is the first step towards getting the right treatment and improving your quality of life. Your breath is precious. Protect it. We've covered 3 very important symptoms today: unexplained weight loss, persistent fatigue, and shortness of breath. My hope is that this discussion has empowered you, the amazing women over 60 in our audience, to be even more attuned to your bodies and the signals they send. Remember, these aren't just minor inconveniences. They can be your body's way of telling you that something needs your attention and the attention of your trusted healthcare provider. Please, if any of these symptoms resonate with you, if you've noticed them in yourself or a loved one, make that call. Schedule an appointment with your doctor. It's so crucial to understand that early detection can truly be a lifesaver. When we catch potential health issues in their early stages, the options for treatment are often more numerous, less invasive, and far more effective. You have the power to advocate for your health, to ask questions, and to seek answers. Don't ever feel like you're being a bother or that your concerns are too small. Your doctor is your partner in health, and they are there to help you navigate these changes and investigate any symptoms that worry you. So let this be a call to action, but one filled with hope and empowerment. Take this knowledge, be vigilant, and prioritize your well-being. You deserve to live a life full of energy, joy, and good health. Thank you for joining me today, and remember, listening to your body is one of the most loving things you can do for yourself. Stay healthy, stay informed, and we'll see you next time.